Want to pass your fundamentals exam? Then let's get started. Today we'll cover 10 questions based on nursing skills. Question 1. A nurse is caring for a client who is post-operative following abdominal surgery. The client reports severe pain at the incision site. Which action should a nurse take first? Administer pain medication as ordered? Assess the incision site for redness and swelling? Encourage the client to use relaxation techniques? Notify the healthcare provider for the client's pain. Pause the video and select your answer. If you chose option A, you are correct. Administer pain medication as ordered. The priority nursing action is to address the client's severe pain promptly. Administering pain medication as ordered will help alleviate the client's discomfort and promote comfort and recovery. Question 2. A nurse is caring for a client with heart failure who is prescribed furosemide. The nurse understands that which electrolyte imbalance is commonly associated with this medication: hyperkalemia, hypokalemia, hypernatremia, hyponatremia. Pause the video and select your answer. If you chose option B, you are correct: hypokalemia. Furosemide is a loop diuretic that can cause potassium loss, leading to hypokalemia. Monitoring potassium levels and providing potassium supplementation, if necessary, are essential nursing interventions. Question 3. A nurse is caring for a client with chronic obstructive pulmonary disease who is experiencing respiratory distress. Which intervention should a nurse implement first? Administer supplemental oxygen? Assist the client into a high follows position? Administer a bronchodilator as ordered? Initiate continuous pulse oximetry monitoring. Pause the video and select your answer. If you chose option A, you are correct. Administer supplemental oxygen. In respiratory distress, ensuring adequate oxygenation is the priority. Administering supplemental oxygen helps improve oxygen saturation and relieve hypoxemia. Question 4. A nurse is caring for a client with diabetes mellitus who is scheduled for a computed tomography scan with contrast dye. The nurse should take which action before the procedure? Ensure the client has fasted for at least 12 hours, administer insulin as ordered, assess the client's renal function, withhold oral hypoglycemic medication. Pause the video and select your answer. If you chose option C, you are correct. Assess the client's renal function. Contrast dye used in CT scans can stress the kidneys. It is essential to assess renal function before administering contrast dye to prevent contrast induced nephropathy. Question 5. A nurse is preparing to administer an intravenous medication to a client. Which action should the nurse take to ensure safe IV administration? Administer the medication rapidly to minimize discomfort. Check the IV site for redness and swelling. Confirm the client's identity using two patient identifiers. Ask the client about allergies to oral medications. Pause the video and select your answer. If you chose option C, you are correct. Confirm the client's identity using two patient identifiers. Confirming the client's identity using two patient identifiers, example name and date of birth, is a crucial step in medication administration to prevent errors. Question 6. A nurse is caring for a client with pneumonia who has a prescription for oxygen therapy. Which oxygen delivery system is most appropriate for this client? Nasal cannula, Venturi mask, non rebreather mask, simple face mask. Pause the video and select your answer. If you chose option B, you are correct. Venturi mask. A Venturi mask delivers precise oxygen concentrations and is often used for clients with respiratory conditions such as pneumonia who require specific oxygen needs. Question 7. A nurse is caring for a client with a history of heart failure who is taking digoxin. Which assessment finding indicates a potential digoxin toxicity? Decreased heart rate, increased urinary output, confusion and visual disturbances, hypotension. Pause the video and select your answer. If you chose option C, you are correct. Confusion and visual disturbances. Confusion and visual disturbances are classic signs of digoxin toxicity and should be promptly reported for further evaluation and intervention. Question 8. A nurse is caring for a client who is experiencing a seizure. Which action should the nurse take first? Place the client in a supine position, restrain the client to prevent injury, move nearby objects away from the client, administer lorazepam or Ativan as ordered. Pause the video and select your answer. If you chose option C, you are correct. Move nearby objects away from the client. The first action during a seizure is to ensure the client's safety by moving nearby objects away to prevent injury during convulsions. Question 9. A nurse is caring for a client with a nasogastric tube for enteral feeding. Which intervention should the nurse implement to prevent aspiration? Elevate the head of the bed to 30 to 45 degrees during feedings. Verify nasogastric tube placement by auscultating for air in the stomach. Flush the NG tube with sterile water every 4 hours. Change the NG tube insertion site daily. Pause the video and select your answer. If you chose option A, you are correct. Elevate the head of the bed to 30 to 45 degrees during feedings. Elevating the head of the bed reduces the risk of aspiration during enteral feedings by promoting proper digestion and preventing reflux of gastric contents into the lungs. Question 10. A nurse is caring for a client with acute pancreatitis who is experiencing severe abdominal pain. Which medication should the nurse anticipate administering first? Acetaminophen, morphine sulfate, omeprazole, metoclopramide. Pause the video and select your answer. If you chose option B, you are correct. Morphine sulfate. Morphine sulfate is the first line medication for managing severe abdominal pain associated with acute pancreatitis. Adequate pain control is essential for comfort and promoting rest.